Hi, I'm Nikki Butler and I'm a skin and scar specialist, and in this video I'm going to talk to you about treatments that are available for self-harm scars. Now, I've treated many clients with self-harm scars over the years and I've had great success with them, but there are a few things that we need to take into account in terms of when's the right time to treat your scars and how they're treated and the results that you can expect to see. So the one thing I'm going to start with saying is there isn't a total scar removal treatment available, unfortunately. It's about improving, not removing scars. That said, I've had very good results, and often the very fine scars can disappear. But we talk about that when you've had your consultation and I've assessed your individual scarring. We will talk through the right treatment program for you. Now, in terms of when is it the right time to start to do your treatment, that question has two parts to it. So firstly, it's when your skin has finished its natural healing process. That can take 1 to 2 years. So initially, you go through the initial healing phase, which we're all very familiar with, where the scars, the wound sites scab over, scabs come off, and we're left with that very pink, raw skin underneath. Your skin is still very much in the early stages. And if you go onto the website and click on My Scar and then follow the process to say your scar is under a year old, you'll have the opportunity to download my Ultimate Scar Guide, which talks through those healing stages. There's also a blog on the website that specifically covers all the healing stages of wound healing. So you may find that useful. So what we want to do is start your treatment program when your body has finished its natural healing process. In my opinion, it's not ideal to start very early on because your body is still trying to heal. And I found that interrupting the natural healing process can actually be detrimental to your treatment. So the way you'll know that your scars have finished their natural healing journey is they start to turn like a white silvery colour. And that's not talking about keloid scarring. So keloid scarring is very different and something I would cover in another video. But if we're talking about how the majority of us heal, when our bodies finish healing naturally, we are left with white silvery scarring. That could be sunken or it could be raised. And that's to do with the abundance of collagen and the type of collagen that's produced during that healing phase. When you're coming to the end of the natural healing cycle, what you may notice is that your scars still flush that pinky tinge either through the scar or around the outside. And that's just an indication that you're very much coming towards the end of the healing. And many people will find that happens when they heat their body, so if they exercise or they have a hot bath or shower. Because what happens when you have a wound site is the blood vessels that are around the wound dilate to allow more blood to flow to the area to help stimulate and help support that healing. So when your body has finished the natural healing process, you're left with where your scars are going to be, that white kind of scar tissue. So then we can start to talk about treatments that are available that can help to re-stimulate the healing process, to break down the abundance of collagen and the scar tissue that's formed, and to help stimulate the melanocytes, which are the cells in your body that produce melanin that give your skin its natural skin tone. So ultimately with scar treatments, that is the aim, to break down scar tissue, to stimulate fresh, healthy cells to replace the scar tissue, and to stimulate melanin production within the skin. And a course of scar treatment is anything from kind of 5 to 8 treatments typically, spaced 4 to 6 weeks apart. And I say the word typically because your skin is the largest organ of your body and it is entirely unique to you. So the number of treatments that you will need will be dependent on the scars you have initially, the way your body naturally responds to treatment, and often age. So we naturally have an abundance of collagen when we're kind of below the ages of sort of 25, 26. And all that can mean is that when we're mature, so I'm 46, I treat my scarring from surgery, and it takes me slightly more treatments because I have less natural collagen within my skin, so I have to stimulate that more. So what we're doing is we're breaking down scar tissue, stimulating fresh healing, and stimulating melanin. And over the course of treatments, what we see is skin tends to flatten out and they start to repigment. So the scars become less visible. And as I said at the start, some very, very fine superficial scars can actually disappear completely. So that answers the question in terms of when to start from a physical healing point of view. The other thing to take into account with self-harm scars is making sure that emotionally and mentally you're in a position to be able to cope with treatment. And that's something that we do talk about at consultation, and I ensure we have a very good relationship during your scar treatment journey to make sure that if at any point you're feeling uncomfortable with how your scars are looking, you're able to reach out to me. The reality is that after you've had a scar improvement treatment, the wounds do look obvious. They do look red, they do look sore, and often they're raised. That's great from a healing stimulation point of view, but for you to look at that can be quite traumatic. So it's important that we're making sure we're starting your treatment at a point that you feel able to cope with that, and during your treatment to make sure you feel you're able to reach out to me and ask for additional support if you are struggling with that kind of healing process post-treatment. So those are the two things to take into account. Now, in terms of the results that you can expect to see, as I said, it is dependent on everybody. I would say that I typically see anything from a 40 to 70% improvement. And usually the reason that clients stop to have treatment is that they are happy with where we get the results to. And it's really incredible because I've had some amazing clients that have been able to wear sundresses and short sleeve tops for the first time ever. To wear nice dresses to weddings that they would never be able to wear before. And I had one client, and I loved her story because she'd had a few drinks, she'd been out on a night out, she took a cardigan off without even thinking about it. And, you know, for her to be able to do that and not focus on her scarring and worrying about people seeing her self-harm scars was amazing. So amazing that she emailed me and told me. So that was like really, really wonderful to hear. And that's what we're looking for, to give you the confidence to be able to feel that you can go out and enjoy your life without focusing on your scars. And as I said, there isn't a total scar removal treatment, but even if we get your scars to where you're happy with them from treatment, and you may have the odd couple of scars that still need to be covered, there's some incredible makeup that you can buy to do that. And it's not skin camouflage makeup. I actually recommend Jane Iredale mineral makeup. Absolutely fantastic, gives better results than any skin camouflage makeup I've seen. And it's a really good way, just if you are going to a big event and you want to make sure that nothing is visible, that you can use some makeup to do that. In terms of the treatments that I use, I don't have a standard scar treatment program. It is about us reviewing your scars from the beginning and looking at the desired result. I tend to use 2, sometimes 3 different treatments. I'm a really big fan of microneedling in varying forms. What I will say is that differs from the type of microneedling that beauty therapists offer. So medical forms of microneedling and radio frequency microneedling are hugely powerful, particularly when they're combined together. And occasionally I use fractional laser. I tend to find fractional laser is very aggressive, and it's maybe in 10% of cases I'll use that at the end of a course of treatment. The treatments do take place 4 to 6 weeks apart, and as I said, it's typically a course of 5 to 8 treatments, and some clients will require more than that. So it is anything from a 6 to 12 month scar improvement journey with me, and making sure that we're timing your treatments around things like holidays, big events, and also your health, making sure you're healthy, you're well, your stress levels are as low as they can be, and this will give your body the absolute kind of best possible chance to give you the best results. So I hope that helps to give you some idea of firstly the fact that self-harm scars can be treated, they can be improved. There are, it's the ability to create some fantastic results, and I find treating self-harm scars incredibly rewarding because I know how much of a difference it makes to my clients' lives and their confidence. If you would like to know more, then please get in touch with me. You can either reach out on the contact form via the website, which is nikkibutler.co.uk, or you can follow the My Scar Journey on the website and book in for a consultation. And as I said before, you'll also have the opportunity to download a copy of my Ultimate Scar Guide. Thanks so much for listening to my video. I hope you found it useful, and I look forward to hearing from you soon.